Hello, and welcome to today's episode of Health University, where I have the pleasure today of speaking with a new friend who I just met, and her name is Alexandria DeVito. Oops, I'm holding up her book. I think it's backwards. So, those who are watching on Zoom, it's called 9 Months is Not Enough. And I wanted to have Alexandria on the call today so that she could share with you her story, her background, what caused her to write the book, what she learned in writing the book, and so on. So, Alexandria, welcome. I'm delighted that you're joining us today. Please tell us about yourself. Give us a little background.
So excited to be here with you. Thank you so much for hosting. And I'm so excited to chat with you and all of your listeners.
Thank you.
So I guess, 9 months is not enough is certainly a labor of love. And really, the reason I wrote it was I've been working kind of in and around healthcare for a bunch of years, first as a healthcare consultant. So I was on the corporate side for many years, worked with a lot of pharma, med device companies, and saw healthcare from that angle for a while. And then I transitioned. I went back to school and got my MBA and then also my master's in nutrition and then transitioned into clinical practice. Gotcha. So that was kind of my way of moving. And what happened after that was surprising and unfortunately disturbing. I had a lot of clients that were coming to see me that were struggling to conceive. And I know this is something that, is very familiar to you, but they were being kind of ping-ponged between their doctor and their therapist and, all different providers and still not getting the answers and resolution that they needed. Mm-hmm. And I realized that the way that we are approaching fertility is certainly not the most efficient and in many cases not particularly effective. Mm-hmm. And what I learned, I trained in functional medicine, so I learned about kind of what does it mean to be a detective and learn about root cause analysis. And I realized, why are we not doing a lot of these diagnostics upfront? Why are we not looking at someone's health in the beginning before they even start trying to conceive? Absolutely. And that was the beginning of the journey into kind of the world of functional medicine for fertility. And then also what ultimately ended up being an exploration of preconception. Mm-hmm. And the fact that we've had preconception guidelines for 40 years plus, and yet still less than 20% of females are being offered preconception visits. And many females don't even know to ask for them.
Correct.
And so it felt like there was an opportunity to really rewrite the dialogue and to really give a manual for people to plan for pregnancy like they plan for any other major milestone, like a wedding, even a year in advance. Mm-hmm. You can start earlier. And to give people a checklist of what are the main things that can be happening that could interfere with fertility, both at a macro level and then also at a micro level for you specifically. So that's kind of what the book covers. And it's for anyone who wants to conceive, whether that's yesterday, which was many of my clients, whether that's a couple months from now or a couple years from now, and to really help you optimize your chances of getting pregnant and having a healthy baby on your terms and on your timeline.
Perfect. That's wonderful. And yes, I would agree that in my clinic as well, patients come in, already way behind, the eight ball, if you will, having tried for, months to years and having just begun later in life, which is a great choice if that's what they want, but without having thought about the things that they might want to do, 3 years ago, if this is the year they want to try to conceive. And I would even go so far as to say that while we have these guidelines that are 40 years old, they're outdated because we are now living in a much more polluted environment, be it, as you say, at the macro level, outdoor toxins and in smoke pollution and all of that kind of thing, heat pollution, or in our homes with our own, sort of personal care, water, and food products. So I couldn't agree more that the sooner we can get people who want to have children at some point in their life to think about what they should look for today and have that be the guiding principle. It's sooner is better for sure. And it's better for the baby who will be inheriting some genetic, excuse me, I got a little recording, will be, inheriting some genetic influences based upon what he or she is getting in utero. So, okay.
It's so important. And I don't think people talk about that enough, but you just said that, the health of egg and sperm, right, passes epigenetic material onto that child, which, sets the stage for lifelong health. And so what you're doing in the 3, 6, 12, 12-ish months prior to preconception is what sets the stage for, for your future child's health. So that's, an expanded view of legacy. And this is certainly something I talk about in the book, is kind of what is the gift that we're giving to our children, and can we give the gift of health?
Exactly. And the answer is yes, we can. I can answer that question. So, and I note that you have a note that you want to make sure men are included in the conversation. So, so people who are listening in the audience, if you are a man, or if you have a man who wants to be partner in having a baby, what would you say to the men?
Yes. So first, I would say, just, on a global level, biology does not care about our cultural construct that fertility is a female problem. I think a lot of times we talk about fertility as if it's just, on the female's shoulders to bear the burden. And certainly when I was working with a lot of clients, I'd work with clients for months, sometimes even years. And then they'd come in and they'd say, we just found out, for example, my partner has no or low viable sperm. Why that is happening months and years into a fertility journey is bananas to me. Yeah. And I vowed that, if I had, agency over this process and to help guide other people, that I would really make sure that it was understood that both reproductive partners, regardless of what the relationship construct looks like, really have a lot of influence. And absolutely. I think, there's the biological side, certainly, which is, right, if we look at even just infertility stats, it's roughly 1/3 male factor, 1/3 female factor, 1/3 combined factor. So, that suggests it's about half of the time. Sometimes both of you have something going on. And we know sperm counts have dropped 60% in the last 40 years. Yes. Testosterone has also taken a similar dive. And so, right, we're not talking about this as much as I think we can and can be. And then I think besides the biological side, right, like where it's actually mathematically not effective to only optimize 50% of an equation, that's not the best outcomes. Right. But secondly, there's the social side of it, which is people are much more likely to adopt health behaviors if the people around them are doing it, especially if this is someone that you are living with. So if you're going to be parenting together, what I like to say is prep together. Yes. And that journey starts in preconception.
Absolutely. Absolutely. And frankly, I would say it starts for the individual, from the time they are entering puberty, right? I mean, we think that we have a free ride through our early 20s, and then we might want to buckle down and kind of course correct. And to a degree, we have some time left, but we're going to have to probably do some significant health problem reversal from that point on as well. Yeah. So I love your point, however, that especially if people are living in the same home, in the same environment, it really serves not only just for their own health, it serves for the dynamic, because it can be very stressful to try to embrace that one is in this moment of what seems like an existential crisis, to try to make some changes, but to have your partner or your roommate deciding that pizza and beer is fine for him, but you go have your veggies and protein. That it's hard. It's hard. The psychological and intimacy becomes forfeited, I think. Yeah.
Absolutely. It's very incongruous. Yeah. So, how do we signal, not just say, that we're on the journey too?
Yeah. Yeah. So you had mentioned, that you said you had mentioned the follicular genesis arc, right? Because I heard you say like 90 days, 120 days, that's almost the minimum, right? Is because that's, from primordial pool to antral follicle that's going to be ovulated this cycle. But of course, ideally, we would start sooner. That being said, if someone is showing up to you today saying, I'm about to enter an IVF cycle, what might you say to that person? Because that is often my patient population, our client population, are the ones who, they're going in maybe for their third attempt to a stim cycle for IVF.
Yep. So first, I would say on the timeline, it is never too early to start. It is also never too late to start.
Correct.
Both things are true.
Right.
And so if you're just coming to this, now, and these are most of the clients that I worked with as well before I founded my company, just breathe. It's, we're going to find a path through. And I think that you said this really well, and this is something that I focus a lot on in the book, is at every stage and with every type of method you're going to use to get pregnant, whether that's IVF, IUI, naturally, egg quality matters significantly more than egg quantity.
Correct. And there is a correlation, to be sure. However, there's not an equal sign that your quantity equals quality. Whether you've got 20 follicles or you've got 6 follicles, it's the same story, because oftentimes a person who has perhaps a polycystic presentation thinks, I've got tons of follicles, and those follicles are not going to yield a high quality egg, because the metabolic nature of a PCO person is such that the eggs are living in inflammatory follicular fluid, for that matter.
Yeah. I think that's a great point, is that on either end of the spectrum, you might see suggestions of compromised egg quality. And, unfortunately, we don't exist in vacuums. Our bodies are a very complex interplay of different hormones and different signaling molecules and so forth. And so we can start to see these correlations between different data points. That being said, what I, generally tell folks is the data is continually evolving, right? We can't yet age backwards. Although, there's some promising science suggesting we might be. And I was actually just at a longevity conference this weekend talking about ovarian aging and, the new interventions that we're seeing around ovarian aging. So there's some promising stuff coming down the pike. However, we're not there yet. And so, we don't yet know how to change ovarian reserve, i.e. from a quantity perspective. But there is plenty of science and suggestions, and certainly in in the work that you do and work that I did, there, I've seen this over and over and over again. There is a huge swath of things that we can do to improve egg quality.
Correct.
And that, involves, again, this is the macro and the micro, right? So from the macro, it's some of the things you were talking about earlier, removing anything that's like a fertility blocker in your environment, right? That can be cleaning products. It can be home care products. It can be furniture. It could be
your clothing.
Exactly. So, I mean,
most of our clothing, in fact, I had the good fortune of having a conversation with a woman named Jenna Hua, whose business is called Million Marker, and she does testing on environmental toxins and their ill effects on fertility. And it was shocking to me to realize just how much of our clothing has chemicals on it. If it's wrinkle resistant, you're wearing chemicals. So you certainly, and if it's wrinkle resistant, you might be putting your head on that pillowcase and sleeping for 8 hours, hopefully 8 hours, on chemicals. So there are definitely things that we can do to clean things up.
Absolutely. And that takes, that can take time, right? We want things to happen really quickly, but figuring out new products, right? Like even just swapping out my own deodorant was a journey, right? And there's certainly ones that we know tend to be cleaner, although cleaner doesn't always mean fertility friendly. So we have to be conscious that we don't have endocrine disruptors in some of these products. But, what works for me may not work for you. And so it can be a journey to figure out something that works with your body composition and, in the environment in which you live. And so, I think having grace in this period of time is incredibly important. And also realizing there's still so many other things, right? Optimizing nutrition, certainly that's near and dear to me. And, to me, diets have often been used as a means for restriction and, managing downside. And particularly when we think about the prenatal period. And I think a lot of times reframing here, thinking about how do we maximize upside? So how do we maximize the amount of nutrition that we're getting, the variety of different foods that we're getting, and thinking about all the abundance that is available to us rather than what we can't have? Because it's truly rarely what we can't have. It's, what is not in service of us for this particular time, for this particular goal that we're going after.
Exactly.
So I think this
is not a forever story. Yeah. So I would say two things come to my mind that I would like to make sure that the audience hears, the listeners hear, is that while it can be complex, any improvement is improvement. And our bodies are masterfully designed to take those improvements and make beneficial changes for our whole health and our reproductive health. So don't presume you need to go down the rabbit hole and find the one thing that works for you. Make a change. Let it be like a layering effect where, your first swath is to clear out the things that if you can't pronounce the items on the label, that's probably something to get rid of. And so don't worry that you haven't then switched it to the perfect solution. Any improvement your body will receive lovingly, happily, and start to clean itself up as best it can.
That is such an important point. I think, we can get so overwhelmed sometimes with all of the data that's coming at us and trying to figure out what to do and experimenting, and just taking a step forward. And, having faith that your body is incredibly resilient. I mean, even on the chemicals front, majority of chemicals are non-persistent, meaning once you remove them from in and around your environment, your body will detoxify them, sometimes with support, right? But that is the beautiful thing that, our bodies, if we take the things that are, I'm going to use the word assaulting them, but maybe it's maybe more.
I use the word insulting them.
Yes, insulting. That's a better way to say it. Insulting them, then your body, will find its way to homeostasis.
Yeah, beautiful. So, but I want to highlight what you would like to highlight in the book, because it's a power packed, it's full, it's replete with all kinds of information. If you were to give the listeners sort of 5 points from the book that you would say, oh, please, consider this book because it will offer you 1, 2, 3, 4, 5, that, a quick takeaway. We're all quick takeaway people, right? Give us the goods.
Yeah. So I would say the first thing is that preconception is its own unique period. So historically in women's healthcare in particular, we either have the contraception conversation or we have the pregnancy conversation. There doesn't seem to be that intervening, conversation, which is the period of time where you're trying to conceive, preparing to conceive. And I believe now is the time, it's been the time for a long time, but now in particular is the time to have that conversation and to understand that preconception is its own distinct, unique period with a series of things that you can be doing to prepare. So I think that's the first one. I think the second one is that I firmly believe that fertility does not have to be a black box. And so I'm a big fan, given my functional medicine background, around testing. And so, understanding what is going on with your unique physiology. A lot of times in medicine today, we treat all 30-year-olds as equal, all 35-year-olds as equal, all 40-year-olds as equal. And that is not biologically true. And it's, a gross oversimplification at best, but it also can be completely misleading at worst. And so I think there's an opportunity to do testing in partnership with your doctor, or we at Papa and the company that I founded, we also do testing to understand the things that could potentially interfere with your fertility. And I know you also offer functional medicine. So I think there's many providers out there that will give you a window into what's going on into your body. And I don't think you should let anyone tell you that you do not have a right to have that information.
Correct. And and in the doctor's defense, I often find myself defending my IVF doctor friends because they're amazing and amazingly compassionate, and they are beholden sometimes to the parameters that their organizations give them. So because any test they order, they would then have to follow through on that test. And if they have not learned, for instance, what might be the nutrition guidelines for someone with, Hashimoto's, or any antibodies, they can only give what they are just kind of allowed to give, some thyroid support, which is fantastic. They need thyroid support if they're going to get pregnant and stay pregnant. But what the person does not know is that there's so much more that she or they can do to mitigate that elevated antibody, that inflammatory response. So yeah, I mean, it really does. That's why we can work in an integrative fashion with the allopathic community, with OBGYN, with IVF reproductive endocrinologists, because we can do what they can't do. It's not that they're prohibited from it, but their model doesn't always embrace or allow that, so, because it becomes time and cost prohibitive at that rate, and for their service. So yeah, I think it's wonderful. For me personally, and I'm saying this for the listeners to hear, I can do labs because I'm licensed in the state of California. For those who are in the state of California, I can recommend lab locations, for the kind of do it yourself. There are lab companies that will do it for you if you're out of state. But I just am saying that because I'm concerned that I'm going to start getting people calling in from Nevada saying, "Oh, I'd love to have the labs done." Maybe they can call you.
Yes, we can do that. That's awesome.
Okay, excellent.
Yeah.
All right. So
I want to add one more thing on what you were sharing, because I think it's a really important point, which is that the system is not yet designed for, a lot of these types of services. And I think that's why, multidisciplinary care is really important. And so I think this is why it's so much more important, or it is very important for podcasts like this to give consumers information to advocate for themselves. Books like mine, so that consumers have the information and that you can hopefully establish a non-antagonistic relationship with your providers where you can be informed and you can also collaborate them to ask for what you need and desire, and find sometimes a group of different providers that collectively can get you the care that you really desire.
Exactly. In my case, we have a couple of organizations. One is international, that demonstrates to the reproductive endocrinology community that we have an understanding and education in what they do, so that we can help translate what they do to the client or the patient. Because I think sometimes that antagonism is coming from being unaware of what we do, because that we're not at odds, that we're working together, we're collaborating for the benefit of our consumer, the patient. We work for them.
Absolutely.
Yeah. So I interrupted. I think I might have interrupted because you were continuing with your Cliff's notes about what points you might want to make sure.
3. So I would say that another thing that's important to understand, and we touched on this, but that you have so much more agency over your reproductive process than you've likely been led to believe. I think there is this very pervasive myth that once we take your pick, depending on where you live in the country or in the world, X number, 30, 35, we turn into pumpkins. Too bad, so sad for us. Mm-hmm. And that is not only disempowering, it is also not consistent with a lot of what the latest science is showing, and certainly not consistent with my clinical experience and I imagine yours as well.
Correct.
And so I think this goes back to what we were saying earlier, is that as long as you are still cycling, there is an opportunity to optimize your health, your overall health, and your fertility is just an extension of your overall health. Absolutely. So there is so much hope and so much opportunity. And I don't think that part is talked about enough. And anything that improves your health also improves your fertility.
Absolutely. But, we're not separate, right? And that includes one's emotional health. I won't use the term mental health because I'm not a psychotherapist or a psychologist, but our emotional health is also going to impact our hormonal communications. And so, yes, all of the players, we're working for you as a team. And ideally, if you've got someone working for you as a team leader, then the onus is not on you to run around like a chicken without your head trying to find your providers, because that can be exhausting as well. Again, because my patient population tends to be those who are going through IVF or egg freezing, but specifically IVF, they're busy. And they're overwhelmed, and they're just trying to work, and they're trying to have this support and these processes in secret, because there's also still this element of embarrassment or shame around the fertility challenge, when, as you said, 1 in 6 people are struggling with fertility now because of all of these things we've been talking about, starting later, environmental toxins, how we eat, how we sleep, how we move. So see if you can get yourself your team leader so that you're not having to be that. You can be the recipient of the care.
Mm-hmm. Yes. The emotional side of this journey is so important. I don't think people realize when I was researching and looking at this, certainly I was watching as clients were coming through and the impact that it had on their, I will say mental health in this case. And the data suggests that an infertility diagnosis has a similar level of stress impact to a cancer diagnosis.
Exactly.
Right. And so
it's existential. I mean, people who want to have children, if they're told that they've aged out or that their diagnosis, and I'd like to put a pin in the word diagnosis because I've got a little bit of a on the pulpit statement to make about that. It
Me too,
requires that they have either donor eggs or adopt or something like that, that it's game over. It's end of life for them. Like that's the experience. So yes, it makes perfect sense that the stress and the consequence of that stress would be akin to being given a cancer diagnosis. Did you want to get on your pulpit first?
Well, I guess the one thing I would say, and actually I really am curious to hear, what your observation is here, but the best data that I've seen is that only 1% of females are sterile, which actually suggests that they're not capable of reproducing, whether that's a structural abnormality from, genetically, or whether, theoretically there's a chance that can also happen post chemotherapy. There's, a very small percentage of the population, 1%. I mean, that is very, very small. But as you said, right, we're seeing infertility statistics that are 15 to 20% of couples. And certainly I think that's way underreported.
I agree.
More and more, right?
Because of the shame factor.
Yep. The rule, not the exception. And so what that really means is that infertility is just a timeline diagnosis. It does not talk anything about your body's capacity. It just says 12 months has passed during which we attempted to conceive and we did not, or 6 months if you're over 35, right? But a year is a very arbitrary cutoff. 6 months is a very arbitrary cutoff. 35, also fairly arbitrary cutoff. So, just understanding that language matters. And so the language that we use really matters. And so I think when people hear infertility, what they think is not fertile. Because when we say in front of things, it usually means not, whatever that thing we're saying. But infertility does not mean not fertile. What we usually see is subfertility, which means that things that are dampening your natural fertility. And we need to figure out what they are. And many of these are things that you talk about on this very podcast, and remove them systematically. And once we do, your body's natural fertile ability usually flourishes.
Yes. Oh, I couldn't agree more. So yes, if I may ad lib to that, it is to say that when the infertility diagnosis was presented at ASRM last year, I had a twofold response. One was, yay, it's getting some opportunity for support, reimbursement, however the systems will support this person. But now we have a diagnosis. And that diagnosis, when we have a diagnosis in our Western culture, it stops, psychologically, it stops there. You have this diagnosis, so therefore we will treat that. So I say to people, well, what caused that diagnosis? Well, then there's another diagnosis that causes that diagnosis. Polycystic ovarian syndrome, endometriosis, diminished ovarian reserve. And so they go, okay, and then what caused that? And we really just need to do that deeper dive, because typically there is an imbalance in someone's life. And I'm a Chinese medicine practitioner, so I'm all about systems and patterns in terms of making a diagnosis. And I don't even like to use the term diagnosis. But it's finding those patterns that created that first diagnosis, and then doing what we can to unravel that and heal that. And then that will heal that diagnosis, getting better metabolic regulation, clearing the body of its inflammatory tendencies because it's been insulted for so long. And then that, as you say, that infertility diagnosis, which is really a subfertility diagnosis, this is the person who says, oh, I was waiting to get my, to get in queue for my stims, and I'm pregnant, because they've done all of that clearing. And then what's most important for me is I feel as though I'm an advocate for the unborn child. That person is now going to have a healthier pregnancy, a healthier baby, a healthier postpartum, better milk production, and so on, because it really doesn't stop with the positive pregnancy test.
Oh my gosh. I mean, so well said on so many different levels. And I'd like to just echo the last point that you made, because I don't think that, as a fertility industry, we've done a great job of emphasizing this point, right? Because a lot of times in fertility, it's a binary outcome. Did you get pregnant or did you not get pregnant?
Mm-hmm.
But I think we're really missing the point if someone is able to get pregnant but can't sustain that pregnancy to term.
Mm-hmm.
Or if they're getting pregnant and, that child is born with a host of health conditions. And so the last point that you were making around, right, certainly this preconception period not only increases the probability of fertility, it increases the chance that you will get pregnant, it also increases the likelihood of having a healthy child.
Mm-hmm.
And
who will have a healthy reproductive life.
Yes.
Yeah, because I was kind of surprised to learn that there is a whole new disease title, and perhaps you probably know of this, but it's the dysgenesis title. So there's ovarian dysgenesis and testicular dysgenesis. That is the genetic, as we started to say before, it's the genetic imprint that these fetuses get in utero that set them up for reproductive abnormalities, and a lot of an increase in like testicular germ cell cancers, or premature ovarian insufficiencies. These are the result, in my opinion, in my Chinese medicine mind, of the lack of preconception care, because that once that imprint is there, it's going to take a lot more work to undo the adverse environment than if that adverse environment was undone, mitigated, remediated before conception.
Yes. I mean, this is a great point, because the science is essentially saying, right, when you are pregnant, for example, with a baby girl, right, you not only have that baby girl, but her ovaries and eggs inside of you. Mm-hmm. And so the generational impacts start to really magnify when we start to think about what you were just discussing.
Mm-hmm. And that baby girl not only has your eggs imprint, it has your mother's eggs imprint. It goes back even deeper into generations. So I guess the buck stops here. if you right, at any point in life's arc, someone can be the change. So I invite the listeners here to take a stand and be that change, because we can make it. We can make a change. It's not going to happen without our activity, our action, our activism, but it can happen when we sort of step up and say, you know what, no more.
Couldn't agree more.
Yeah, thank you. So before, these will be in the show notes, to be sure, your contact information, but is there anything that you would like to say to the listening audience? Because I want to be respectful of your time and the listening audience's time, to say, is there anything that we haven't covered? Because it's been a great conversation, but I want to make sure I didn't go off on a tangent and have you feel like you've missed important points that you wanted to convey.
I think we covered an incredible array. I think I would just go back to, what we were talking about earlier, is just that you have so much agency over this process. And regardless of where you're starting, where you live, whether you feel like you've read all the books and done all the things, or you feel like you should is a very dangerous word, or should have done other things, we can only act from this point forward. And so, right, we try to do what we can. And I would say there is a very important balance. I speak as someone who's spent a lot of time researching this, a lot of time in this field, a lot of time with clients, and writing a book about it. We also can get too caught up in doing all the things.
Correct.
And so it's this consistent balance. It's highly paradoxical between do whatever you can to optimize your health, because, your health is also going to is predicated on, it's influencing how you show up as a parent eventually, right? The energy levels that you have, how you can connect with your children, and so forth. And
your longevity with your children.
Yes. Mm-hmm. Yep. Mm-hmm. And also balancing that with, right, grace and patience, and acknowledging that perfectionism just doesn't exist in this domain. Mm-hmm. And so, walking that line, because stress itself can interfere with the conception process. And we get stressed about being stressed. That's even harder, right? So it compounds. And so this, it's a mental game, it's a physical game, it's an environmental game, it's a social game. There's a lot of different components here to really think about, and trying to allow yourself to do the best that you can, with grace.
Yeah, that's beautiful. Thank you so much. I have a phrase that I find myself repeating to patients and to myself. And it's engage and surrender. It is, and it's evident in all of life, right? You must inhale and you must exhale. You must take in nutrition. You must excrete waste. The sun must rise and then it must set. It's all around us, and we are just a part of that. So there is no thing that you can do, that any of us can do, to assure 100% aside from our 100% engagement. And then, as you say, exhale, give yourself grace, give yourself rest, be everything else that life has to offer. I think that's a nice place to finish up, don't you?
Indeed.
All right. Well, thank you so very much for joining us today. And as I say, everything will be in the show notes so that the listeners can just, look below, get the book, contact you. And I'm so grateful for you taking the time with us today.
Ditto. Thank you so much.
Oh, my pleasure.